So hi, my name is Lakshmi Narayan, and I'm interviewing Dr. Sunil Agarwal. He's the co-founder of the AIMS Integrative Institute, and he is suing the DEA for a right to try. And we're talking about his upcoming uh, lawsuit trial date.
Hello, nice to meet you. I'm joining you from Seattle, Washington. We started a case here from my clinic 3 years ago, fall of 2020, when in the course of my practice as a integrative palliative care doctor, I wanted to find a way to get psilocybin assisted therapy to my patients who were dealing with advanced cancer. Right to try laws allow access to drugs that are not fully approved by Food and Drug Administration, but have gone through phase one, what's called safety testing. And so it was a matter of just simply asking for access to that based on the laws. And then I worked with a lawyer, Catherine Tucker, who had already thought about it, that this is the right way to do this. And we were told no, like repeatedly by the DEA, that there was no way to access this medicine through the right to try law, that it had to come through a researcher, only a researcher Schedule I license, which is fine if you're doing research. But if you're not doing research, if you're trying to take care of patients who don't have a lot of time, you have a right to try law. And that's the whole point of the law, is to cut out a lot of red tape and get directly to the supplier, as long as there's a supplier willing to give it to you. And we had a supplier that was willing to give it to us, but there was just no way for them to transfer it to us without the license. So we took the DEA to court. That was in 2021. We had a lot of briefing. We had a lot of amicus briefs, including the state of Washington Attorney General's office, that supported us in our case, including attorney generals from multiple other states, an entire health system, like professional psychology associations at the state level. I mean, ACLU, the Goldwater Institute, Cato Institute. It was quite an interesting array of interested parties that recognized that this was an important case for, practice of healthcare and medicine, and compassion, human rights, drug policy, and that kind of thing, and palliative care, of course. We waited. We actually had an expedited process, but then the court listened to our case and then waited several months, like I think 4 months, before they gave us a decision, which was like, well, we can't really tell you because you haven't actually, we're not going to decide the case. We want you to go back to DEA and kind of make sure you've exhausted all the possible avenues that you should have exhausted. For a long time, the court was saying, yeah, we recognize this is a special interest case because of the health conditions of these parties. So we'll speed it up. But then they just slowed it down, and then slowed it down even further by asking us to go back to DEA. And, DEA, we went right away and filed again a waiver, a formal waiver, which, and then we filed a rescheduling petition, a psilocybin rescheduling petition, which the DEA suggested we do. I mean, we said, at the very least, Schedule II, because it has accepted severely restricted medical use and treatment in the United States, that it has some accepted use. We didn't want to argue and say that's their decision, but at the very least, the level that oxycodone and morphine and other drugs that are Schedule II, okay, they have some danger, some risk, but they're medically safe for use under medical supervision. That's what the government sets those drugs. So we thought psilocybin meets their criteria. Not just we thought that, but leading researchers, have published papers on that. Matthew Johnson's paper we cited extensively who's at Johns Hopkins. So yeah, we submitted this 9-page petition, and then we submitted this waiver. And then both of them came back over the next couple of months. The waiver was, hey, you guys asked us the same question last year. Our answer is still no, which basically underscored the point that we had done everything that the court said that we didn't do, and the DEA was still saying this is our final decision. And then the rescheduling petition, which they asked us to write to them, they said, oh, sorry, this has not been approved by the FDA. We can't do anything with it. So
basically, they threw it back into the FDA's court, and although the power to actually change the scheduling lies with the DEA, correct?
the DEA is responsible for those ultimately. It's been delegated by that authority by the Attorney General of the United States. But the medical and scientific decisions are delegated to the Health and Human Services Agency. And so what they're supposed to do is, if there's a question about whether something really requires a medical scientific review, when they get a petition, they're supposed to send it to the HHS or FDA, which is under HHS, and ask them for their review.
So
Just
they're
like
supposed to work together. These two government bodies are supposed to work together in concert to do the right thing for the American people. So
that's right. That's right. And they just decided we're not even going to. Our preliminary look at it, they say that they have some degree to choose whether to even enter it into the process, and they say no, and then they basically say the reason they won't do that is because the FDA under HHS has not made a determination as of yet, so we can't do anything. So it's kind of they did a catch-22, very circular, thing. And I got this letter in September of 2022, I guess it was. Opened it in this room, and I was like, "What? This is, just a few lines. They simply say, "Thank you very much, but we can't do anything with this." And I was pretty bummed. I was like, "Oh, this is ridiculous." Like after all of that waiting, but the attorneys looked at it and they said, "Oh, this is great. Like this is really good grounds for appeal. This is they made legally the wrong decision. We can really." We can challenge this because this is not the way the law is supposed to work. And so that is now the case that we're going to be arguing in on Friday in Phoenix.
What does success look like with this case? What are the grounds of the case?
They're arguing basically that number one, that the court has been acting in bad faith, or not the court, the DEA, excuse me. Just Ninth Circuit Court is going to be the one that we'll be arguing before. So they're like one step before the Supreme Court. They cover a large range of the Western United States, and we are basically asking the court to review their denial of our petition to reschedule psilocybin. There's going to be a live stream, by the way, on the day of argument as well. So people can tune in if they go to the Ninth Circuit Court website for live oral arguments on the 20th. It's going to be argued by an attorney named Matt Zorn from a law firm called Yetter Coleman. He's a Texas-based, really brilliant attorney who's done a lot of work on challenging DEA on their transparency, their processes, like all kinds of things. They really are. He's, I think, Columbia law graduate, just really sharp, brilliant attorney. Our case is like that the DEA has attempted to usurp the authority that Congress gave to the HHS. We want the court to recognize that we've presented sufficient evidence to require the DEA to seek HHS's medical scientific opinion on our petition.
How long have we known about psychedelic medicines for end of life? What is the argument or reason given by the DEA for keeping it scheduled as a Schedule 1? Don't we deserve to get a reason back at this late stage when we've known about these medicines since 1960?
Right.
And also, if it is that it's a psychedelic drug, isn't morphine, which people get at end of life, also a mind-altering substance? It comes from the poppy. It is also a plant medicine. Other medicines like levodopa create altered states of consciousness. And
That's
then,
right.
there is a lot of literature and studies about the spiritual and existential paradox of death. What is the case that the DA gives us for not allowing psilocybin to be reconsidered and made accessible?
Beautifully said. I mean, first of all, regarding morphine and all of that, I should say, so these laws that we're dealing with are from the administration of Richard Nixon, 1970s president. And he's the one that signed this controlled substances law into effect. That's the one that they're relying on, here 50 years later. And I have listened to a lot and read Nixon tapes, transcripts where he's discussing in private his ideas about drugs, because I'm interested in it as a researcher, and I've published some articles about some of his references to marijuana and the politics of it. But he also in those tapes talks about the plight of patients with cancer and their need to have pain relief. He's talking to some confidant and he says, it's horrible. Some of the, in the early 70s, there wasn't a lot of the treatments that we have. And there was some pretty serious cancer situations. And he was just saying, it's really terrible that patients will endure this, and they should be able to have any, morphine or any painkillers that they want, just to relieve them. So this was not a heartless person. He did have some ideas like that. So it's interesting, that now his own law is being interpreted to deny people like that. But the opioids and the painkillers like that, they created a different category for these substances like psilocybin, LSD, because of their association with the political unrest of the 1960s and early 70s around the Vietnam War. Many of the activists who were organizing to fight against the mobilization, the draft, they also enjoyed psychedelics as part of their lifestyle, as part of how they helped them to deal with the trauma of being asked to fight for a war they didn't believe in, or just the cultural situation of growing up in the 50s and whatever. So it was a part of their culture, part of their customs, and it had a role in their well-being. And they just decided, let's just use that as a political tool to get those people. And it's not just my words. This is literally the words of former Nixon advisors who've been on record. But there were, as you mentioned, studies as far back as 1964, when the first study was published that showed at University of Chicago, there was a researcher named Eric Cast, and he's a psychiatrist and internist, and he showed that he could give 100 micrograms of LSD to 50 terminally ill cancer patients. They also had severe burns and other illnesses, and he showed that he could actually reduce their pain of those conditions compared to Dilaudid or Demerol.
And then the other thing he says is that it allows them to alter their pain, attention, and perception, right? So that's really a really important function of how psychedelics work to change your consciousness, changes your relationship with the pain and your perception of death and dying and what it is, and you have less fear of these things. And
exactly, if you have a lot of anxiety around your mortality, which of course is a universal human experience, but the sort of the kiss of death, or the diagnosis that when you get that in your mind, oh my gosh, like doctors think you have a condition that's going to end, that we don't really have a cure. I mean, those kinds of things really do can create so much anxiety in some people, existential distress we call it. It actually makes pain worse. Dr. Cast was like, I'm just interested in like relieving pain from tumors or burns. But his later studies, he began to see that there's a lot more going on than just like taking a painkiller.
So then the other question I have, and forgive me if I'm being naive, but what I think is, okay, so in the 60s, we as a people, we as a government made all these laws, and it was a reaction or a response to what was going on then, whether it was political or socio-political or whatever it was. But here we are now, it's 2023, 63 years since that. And when are we going to reassess our decisions of the past, which don't serve the present moment? And I find I find the reasons insufficient in the face of how many people could benefit from these medicines and how many people are dying because of lack of access to some of these medicines. So many things, or dying less peacefully than they might in your case.
And I think in terms of how healthcare and access to medicines has become more and more a corporate issue, like special interests, to use that term, versus the sort of ethics of humanitarian life, liberty, and the pursuit of happiness, which is kind of a constitutional, okay, you have a right to have some kind of happiness in your life here. That doesn't mean at the behest of Pfizer. It's just like you just have this right, period, and the government's job is to sort of ensure that, enshrine that, protect that. But over the last 60 years, with the way that we have allowed healthcare and drug development and all these things to go, they are one of the most powerful lobbies, and everything sort of, they get so many billions of dollars, some of these insurance companies and things like that, hundreds of billions per year in revenue and profits from the way that they run things. And they make money on every side, like just the insurance, the drug benefits, the pharmacies, they even run hospitals now. I mean, they really have, the whole field has become extremely corporatized in a mega way. So they get to write laws, like that. When you get that kind of power, they have so much influence that they get to write laws as well. So a lot of the field, it feels to me, of like what happens in FDA and HHS and maybe even DEA too, has become like, well, we do things as long as the people, the corporations that we're working with are happy, are wanting that way to move. And right now, because of all this established sector, there is a lot of companies that are developing psilocybin. I mean, because of this evidence is so strong, they say, well, we're gonna raise some money, we're gonna put it through clinical trials, just like the Right to Try one was based on, and they are kind of waiting for their return. The return means a monopoly on exclusive distribution after they've done all their R&D. Then after a period of time, they get exclusivity, and they get to sell their drug, and they'll make lots of money. And I mean, that's the model. That is the model of drug development. So I can't say that has nothing to do with what's happening right now in this case.
Exactly. So I'd love you to comment on this thing I've noticed. So the plant medicine, psilocybin, for example, is a whole plant that's evolved over billions of years, has been used for hundreds of thousands of years. We know that there were mushroom drawings in the cave walls. We know that's how old mushrooms are, right? And so it's evolved its co-relationship with human beings, compared to isolating a molecule or two so that you can patent it and have exclusivity. So you're reducing the effects of this highly developed plant medicine to a couple of molecules and just a few years of research to fast track it. And while at the same time, the plant medicine's legal access to people is being suppressed, there is something very evil going on in this scenario that affects human health and happiness.
Beautifully said, Lakshmi. I couldn't agree with you more. Absolutely, the use of psilocybin fungi is probably, I mean, there are papers from anthropologists and evolutionary biologists that suggest that it had a role to play in the development of human social, what's called a socio-cognitive niche is the term they use. Like just the reason that people are more likely to get into a group and trust each other a little bit more, look at their faces and say, okay, you're not a threat, you're more of a friend, and let's kind of get along, and let's get along together. Like that's what people are arguing, that psilocybin actually helped people work more cooperatively in groups, which of course, has led to so much of our development in our species. If we were all very much, mistrusting each other and kind of enclaved and factioned, we wouldn't have been able to make the progress we've made in so many things. So there's an evolutionary, so it's so old and so important to the way that's the theory. I mean, that's like, that's a current scientific theory. And yeah, there's archaeological evidence and there's lots of other reasons to believe that these substances play a key role in our culture. So yeah, I don't even think the whole idea that you would then prohibit. So, we're kind of operating on this. The prohibition is a sort of the first strike when we just started saying no to all these things, and we're going to ban these because that's groups we don't like. And even before the 60s and the Vietnam era protesters, there's also a lot of history in that same article on Nixon. I looked into this too, about the federal raids on peyote in the Native American reservations across the United States, like in Arizona, New Mexico, other places. They would simply just, that was another tactic they were using to suppress the, to arrest. And, they didn't like the politics of Native folks. And, there's a long-standing war. Anyway, so that sort of was the standing thing. These substances were associated with groups like indigenous people and like protesters that they didn't like, and so that's really why they were first banned. And And so, and then if you can trace that even further back to the 1500s when the Spanish conquistadors came to North America, and you can look at the journals of the missionaries and say, oh, this is they're taking a diabolical mass. They call it a satanic mass to eat the flesh of the mushroom rather than the flesh of the wafer. You know, they literally, I mean, that's what they were. So that was the lens that they were operating in. This is, you guys are doing a sort of foreign religion to us, and we're going to stop it. They actually, that's why the whole thing went underground for 500 years. The whole framework, which the Spanish Inquisition, which they brought over here, was an idea. We need to stamp out heresies. We need to stamp out what is the devil lurking, and all of that we know is also was tied into sort of kind of a shadow work that people didn't want to do about like women healers and witches and all that stuff. And you know, there's all kind of, and Jews, there was a lot of like fear about anti-Semitism that the First Inquisition, but there was other heresies as well in Spain. So there was mistrust, fear of nature. I think there was also authority control. Who's going to have access to powerful things to heal your soul? Is it going to be the clergy, which are males, or is it going to be women?
I think you hit upon something here. And maybe it did get divided into this gender, men or women. But I don't like to go there so much because I find that it just creates another gender split that we don't need right now. It's more about power and external power, or the power of access. So
Yeah,
it's just the same thing that happened when the church came between a person and their communion with God and said, we're the intermediary.
yeah.
But just the same thing when the priests in India said, you got to pay us to do the puja for you to get what you want. And
Exactly right.
right,
That's right. That's
we're
right.
doing the same thing again with saying that you have to go through a medical body or whatever. And I know that that's the direction the whole psychedelic thing is going. But honestly, it will go that way, and there's going to be many people who would prefer to go to a doctor and
Yeah.
who are too ill to do it any other way or whatever the circumstances. But there will always be people who will also could also access it and heal themselves, because
Oh
that's
yeah, absolutely. That's right. I'm very much in favor of really having any and all systems, and they can all live side by side. I mean, I was talking to somebody about water. You know, like we have all this municipal system of water to drink tap water. You know, there's all these testing that goes on, chemical testing at the plant, processing, et cetera, et cetera. Your pipes, you drink it. But then you can also have holy water where you think it's blessed and holy, and you can send it on the internet to other people because it's been touched, or Ganges water, if you want to talk about India here. You know, nobody is saying that water is like has to go through all those channels. It's like, no, people have a deep relationship with water. It's a very fundamental element, and there's so many emotional ties to it. So the same way, entheogens, the fact of nature that we have these kinds of substances that humans have formed special bonds with over the eons cross culturally. So we have to just find a place for that. So you gave the example of the Catholic Church mediating the relationship to God, and then the big change of that was the Lutheran Revolution, or the Protestant Reformation, they say, you know, where the Protestants said, no, we're going to, you know, put the Bible in our own language. We're not going to go through the priest. We're going to do our own direct connection. And that was a huge shift, you know, and that led to a lot of changes actually in culture. Even the foundation of like hospitals for the poor, things like that, apparently was I've been reading was tied to that.
Well,
So in this,
hospitals for the poor is a great thing to bring up, because at one time hospitals were created by churches, and they were charitable organizations where poor people could come to get healing, and the spiritual component of it was completely integrated because it was inside the church. Then healthcare became in the secular state, part of the secular state, and religion is here in this camp. They're separated. And so all the arguments that you have about the metaphysical, existential, spiritual
yeah,
dimensions that psilocybin opens up become like irrelevant, it seems.
right. I mean, thankfully, palliative care, the field that I'm in here, has made more strides than any other branch within the formal field of medicine to reintroduce those elements into our system. I mean, I believe in an integration. That's why I'm integrative medicine. I want to bring these together. I think there's a way that they can still function. I mean, always medicine has been a little bit of, you know, secular, a little bit of religious. Like it's together. It's okay as long as we really try to make a universe, like make sure everybody's beliefs are respected, everybody has a consciousness. And I'm just saying that, like, the revolutions that we've had around access to divinity, or, you know, whether it's mediated through a church or directly, had huge impacts on culture and society overall, even the printing press and things like that. So access to information. So Thomas Roberts and Jonathan Odd have talked about the entheogenic reformation, that we may be going through a phase where these substances will force a larger changes in terms of organization around how we handle issues around spirituality, or access to nature, access to healing. Like, all of these prohibitions really came from that original zeal to separate, you know, to do the power thing that you said, which, you know, was all about access, and then it went underground. And then it wasn't until 1950 something that Valentina Wasson, you know, the doctor, she's a pediatrician, with Gordon Wasson, they went to Mexico, and they were able to sit with Marita Sabina in a midnight ceremony. These ceremonies were not done in the daytime because, again, of the history of the 500 years of Spanish Inquisition. So they did that, and they were recognizing already, oh my gosh, this could be really helpful for people facing terminal illness. And we know this now. We actually had several. It's such a kind of it's a fascinating example of, we know something, but because of our, you know, wedding to this really broken system, our government has chosen to sort of ignore it or pretend like it doesn't matter. And I don't think that's going to really last too long. The DEA agent was fired from his job. He'd worked for many years. I forgot. The case was in Pennsylvania just a few weeks ago. You can read about it. He had some kind of spine or hip or knee issue, some serious pain, you know, and he was trying to avoid using opiates. So he bought CBD, you know, cannabis derived CBD, probably a whole plant extract. You know, the Congress has made CBD hemp to be not considered controlled under the 2017 Farm Bill, and so you can get it without having to, you know, have any kind of scheduling issues. So this DEA agent did that because he wanted to avoid opioids. They were fighting the opioid thing, and anyway, he tested, then they randomly tested him, and he had some little bit of THC in there, because that's cannabis makes both an isomers in small amounts. Even if you read the FDA approved CBD label, which is Epidiolex, is a company that makes a CBD product that you can get for epilepsy, it says on the label, oh, you might test positive for THC, because, you know, that's just the way it works in cannabis. But anyway, he lost his job because of this, even though he'd served in the DEA for many years. They said, you know, you should have known better. So then he went to court to challenge this. He's lost all his benefits, retirement, everything. And recently the government filed back in the case and said, no, this should stay, because he made a foolish decision to go along with, you know, trying this stuff. Basically, the DEA is saying,
what they're saying is that the wisdom of all these researchers, all this anecdotal evidence, all the people who are being helped with CBD, and all the evidence there is foolish. That's really what they're saying.
Yeah, it doesn't. Yeah, even if it's true, like, you're not allowed. You know, and it's like, I don't know. I haven't read the briefs enough to see, but it was interesting to me to see this, because this is an actual human being that works for the DEA. That's like a career veteran senior agent. So even there, I think the system is so big and confusing that people in the system also don't know what to do about it. Like, we've created a sort of a Frankenstein, a monster, and it's so, like, even they, you know, who are supposed to be enforcing these laws, they can't actually follow them themselves, because, you know, they're human beings. And
the evidence is mounting as to the benefit of these medicines. And I think that's really, I'd like to end on this. I think that's really what we all need to focus on, is the benefit of these medicines, these psychedelic class of medicines that have been mistakenly scheduled as harmful drugs with a potential for recreational abuse. Sure, some of them do have a potential, but some don't, like ibogaine, for example. So that's really what we should focus on. Even those people in the DA, these plant medicines can help the evolution and the evolution of your personality, of your being, your relationship with the world, your intelligence, your creativity, your health. Of course, is the first thing. That's the reason we're here. But that's the beginning of the stair step of things that it opens up. And
Very strong evidence. Absolutely. We know. I mean, and it's not like there's also evidence of risk. Everything has risk. So, like you said, and I think it's like it's okay to know those risks and take a calculated risk for a benefit, and that's sort of that's what freedom and being a human being sometimes. And as long as if you do have, like in the case of medical stuff, okay, you have somebody advising you who's supposed to be an expert or whatever, that's great. And I don't think everything has to be medically advised, but let's just say if we were in that category, like that's really I think that's a fundamental right. And we've really just lost that by this prohibition thing. It just turned into like, oh, there's no way. You can just only research these. You can never try them. But
well,
I think,
speaking
yeah,
of risk, all these pharmaceutical ads that I see for medications, and then they talk about the side effects. Well, a lot of times the risk of the side effect seems worse than the actual thing that's being treated. So it's a hypocrisy to say that there is a risk to these medicines.
absolutely right, exactly. Yeah, there is. I think that's again the way in which we're one of the only countries in the world that does this direct to consumer advertising of drugs like this. Like many countries have banned this. There's no reason. Nobody can make a decision about their stage 4 rare tumor type. Like, they have ads for all kinds of things now. And it's just because we just have completely given up on any kind of, like social agreement around what is the role of our government in helping us have accurate health information, if that's what it's going to be, or filter us from the predatory actions of people that want to just make a buck and actually monopolize. Like there's all kinds of, this is a monopoly game. I see this as basically the governments have basically lassoed these natural compounds, the psilocybin, they roped them up, and it's a monopoly. You're monopolizing a natural germplasm, plant genetic resource, or fungal genetic resource, and then you're selling it off to the highest bidder. So that's really what this is. It's a monopoly game, and we need to break those for the benefit of our for people. That's where this becomes a people's right
We have
to.
to educate the people have to get educated and then experience it themselves and then understand what it is and what it's not and wake up. We really have to wake up. And I wish the people in the DEA and the FDA a speedy awakening so that they can understand that having access to these medicines is going to help their loved one someday who's going through cancer. Or it's not just for us, it's them, it's for all
Correct.
of us.
That it's for all of us, and I think that is a very beautiful place to remember. We're not doing this for we're doing this for the benefit of all. Everybody faces illness, everybody faces death, everybody faces mortality, everybody faces blocks, and psilocybin. So I think I'm really interested in the Oregon thing. I don't know what you think about. They have wait lists of, I think, 100 or 1,000 people waiting to get into the service center to have a guided journey with psilocybin. I mean, I'm happy to see that. I mean, it's crazy that there's wait lists and everything, but it's like eventually we'll get through that wait list.
It tells you how much need there is. There
Right.
we have a need for accessing our psyche in a real for having an inner relationship that's real. We have a need for it.
Absolutely, we do.
Well, I
It's
think we should close on that. And can you just to sum it up, tell us uh, where we can find you or where somebody can find more information? Would it help? Well, what would help you with getting a good verdict for this?
I think packing that courtroom, honestly, we'll be putting out a press release soon. So hopefully there'll be more, people will hear more about it. So it's really just putting your attention on us. And if you know people in Phoenix who are interested in this or want to come there and see this case, we're asking these questions in a very open way, in a very public setting in a high court. And I think people should listen. And if you want to be there or let people know about it, please do so. I just want them to know that people are watching, they care, those who know about this important issue, the ethical issue lines that it crosses. Yeah, it's going to be October the 20th at 9 o'clock in Phoenix, in the federal courthouse.